All right, so the question is, why do I enjoy contributing to continuing nursing education through med-ed? And part of that goes back to my history as a nurse. I've been a nurse, a critical care nurse for over 20 years, and I originally thought I wanted to be a nurse anesthetist. So I was on that road and checking all the boxes to go to graduate school. And once I got to graduate school, the opportunity came up to teach, and it was for a test prep company that helped nurses prepare for the NCLEX, and it was a scripted opportunity, and I started teaching, and I realized how much I enjoyed being able to reach nurses one-on-one and being able to help them prepare for their nursing career. And I realized that I did not want to spend the rest of my life in the operating room as a nurse anesthetist, and basically was able to change my major to a clinical nurse specialist, to be an educator at the bedside and clinically involved as a clinical expert. A friend of mine worked for med-ed, and we worked together at this hospital, and she said, you should really look at, teaching with med-ed. And that was the best decision I ever made. It's been a wonderful experience, and med-ed itself is an amazing company that started at the grassroots level and is now touches just thousands and thousands of nurses on a daily basis across the country, which is just amazing to be involved with. And to help nurses grow in their professional development, to help them prepare for certification, is so rewarding. And to have people reach out to me or send me an email and say, I'm taking my test today, please make sure you say happy thoughts for me. And I tell all of the people who come to my classes, if you want someone thinking happy thoughts for you that day, let me know, and I will be your cheerleader that day. And to have them email me or text me a couple hours later and say, oh my gosh, I passed, is the best feeling in the world. So as nurses, we have to fully embrace the concept of lifelong learning, and med-ed provides that ability for nurses to do that through live seminars, through online education and e-learning, and they have so many different venues and products available for new nurses developing their skills, to advanced nursing, to certification, prep, and review. And so that has provided me the opportunity to expand in my teaching capabilities, not only through med-ed, but then also in my own organization, through other national organizations, and being able to utilize those skills and talent, so to speak, to share with other nurses on a variety of venues. Conferences, Currents is med-ed's national conference they have every year, and it's a wonderful opportunity to have so many different topics available for a variety of nursing specialties. And so I just feel very blessed to be able to do this. So it's been a great experience from that perspective.
Can you talk a little bit about the intrinsic value that you gain from teaching?
I think by teaching, I'm able to share my own experiences and my own life lessons that I've learned and the mistakes that I've made. And I will fully admit, too, that, as you go into this career, I'm a second career nurse. I actually started out as a medical sales rep. My first degree is in biomedical engineering and French. That's a long story. But I realized that I didn't want to be, as far as the biomedical component of it, I didn't really want to be in a lab or that type of thing. And actually, my father was diagnosed with cancer, and I was spending time with him at the Mayo Clinic in Rochester, Minnesota, and the people there said, well, we just thought you were a nurse, because I had all the anatomy and physiology and the medical sales training that I had done, and it was literally like a light bulb went off, and I realized that was what I wanted to do. And once I got into nursing and those experiences, and to be able to share those lessons and to teach at the bedside and help new nurses develop those skills. And the rewards are so amazing to see people that the relationships you develop that I haven't seen in years, and the people who helped orient me to critical care, and that relationship that you develop with them, and then to be able to share those experiences with new nurses. And, I've always emphasized in any of my courses or lessons or anything when I'm teaching is that it's not enough for you to gain the knowledge for yourself, but you have to pay it forward and pass it on and help other nurses learn those same lessons and develop those skills and that intuition and listening to your gut when you think something may be wrong, and that you develop the courage to speak up if you think something's wrong or that something needs to be addressed with the patients. So it helps. Not only has it helped me grow as a person and as a nurse, but also it influences how I treat others in my life, my children, my family, my friends, my colleagues and coworkers, to always have that positive attitude of building each other up and helping them grow and help others be successful, and not just looking at it from your own perspective, but sharing that knowledge. And there really aren't words to describe how rewarding that is. So I feel very blessed and fortunate to be in the situation that I am to be able to do this for others.
How do you feel hospital patients will benefit from nurses gaining this extra continuing education knowledge?
I think, hospital patients and hospitals will, benefit, by having nurses, pursue continuing education. And I think that's one of the greatest frustrations I have now as a clinical educator and a clinical nurse specialist is that in light of all the changes with healthcare reform and with budgets and reimbursement and looking at quality outcomes for hospitals, and they look at education as non-productive labor. They look at this as a soft cost that we don't really need, and so when they're trying to make the budget cuts every year, education is one of the first things that are cut. The education departments in hospitals are becoming smaller. They're huge hospitals that are managing all the education requirements for these nursing departments with just a skeleton crew of people. And so what are the options that hospitals have then to be able to meet the needs of the patients and for the nursing staff as far as the requirements they need, the education they need, the competencies they need? And I think by looking at these other venues, such as what MedEd provides, with online certification courses, with continuing education courses, with the NEXT program, with all of the other opportunities that are provided through a variety of venues, whether it's through books or tapes or e-learning, it gives hospital educators and hospitals the opportunity to provide that education and development to their nurses that they desperately need to help improve patient outcomes. And when the nurses have those skills and competencies and education, and it can be validated through certification and competency training and those types of things, that patients are most definitely going to benefit from that by looking at what can we do better. When we look at quality improvement, we look at length of stay, we look at complications, hand washing, nursing quality measures, infection rates. All of the things that nurses can learn about and develop those skills are only going to benefit the patients that much more, so that we can care for them to the best of our abilities. So I think by pursuing other venues for education is a tremendous opportunity for hospitals, especially in light of the cuts that sometimes administration will make by not having the on-site services available for their staff, by cutting staff. So now we can provide those services by either on-site conferences or education symposiums or seminars or even e-learning opportunities. So it is tremendously beneficial, not only from the nursing staff, but for hospitals and their patients as well.
Is there a seminar you taught that's specifically memorable for you?
Oh my gosh, there's been so many. There's so many things that I'm passionate about. Certification is definitely at the top of my list, and to help nurses achieve something that is truly remarkable. Fewer than 10% of all nurses actually pursue certification, and so to help nurses be successful in that and help celebrate that success and help them realize what a wonderful accomplishment that is, I think is very rewarding. I also enjoy, when we talk about different emergent type situations, whether it's related to cardiovascular emergencies or sepsis or some of these other clinical situations, and helping nurses identify those more readily and have the confidence and competency and knowledge to act on it when they know that something's wrong, and that they can intervene quickly and hopefully change a patient outcome, or recognize and rescue a patient that may be getting into trouble with that. I've always enjoyed Currents because there's so many different speakers and so many different topics, and so not only from my ability to participate and present at the conference, but then also to listen to the other speakers, because I don't get that option very often to hear the other speakers that MedEd uses, and so that's always been a rewarding opportunity as well. So it's, there's just not really one seminar or conference that I can pinpoint it to, because I've had the option to participate in so many. So it's really been a wonderful experience from that perspective.